Welcome back to another episode. Here we are, ready to talk about healthcare in the United States, with a bit on the National Health Service. I've received a response video from Improve Sheffield, and I am very grateful to him for reaching out to me in this way and beginning the debate that I've been trying to have for a very long time now, and that is the debate on the socialized healthcare system versus the U.S. system, which I must say, Improve Sheffield does not believe it is a system at all in the United States. There is method in the madness there that I hope to bring to light as we talk about it more. So once again, Improve Sheffield, thank you for your video. Thank you for engaging with me. The debate that we have here, the debates that we are having, in my view, hopefully will bring out a positive solution that we can move forward with. Now, there was some discussion on the name of my video. The name of my channel, The Wealth of Nations. And it is assumed that I take that as a Bible, which that is not the case. I see it as a book that laid out simple philosophies and identified different things that happen in a market when people are free to engage with each other and free to trade, and the good that comes from that. It is sometimes described in the book as the invisible hand. And I take the position that where the invisible hand has been allowed to work, where it is allowed to flourish, it has been positive. So it's just an homage, really, to Adam Smith and the whole idea around the wealth of a nation, how it becomes prosperous. And my hope is that as many people as possible who read this channel or watch this channel may find ways to think about ways their communities, their families, their nations can be prosperous in many different ways. And I'm not just talking about growing rich and having lots of material possessions, but culturally rich, rich in wealth, etc. Now, I need to address as well the assumption that was made that I am a libertarian. Improve Sheffield, I cannot say that I'm a libertarian. You may have seen in one of my videos, I got lambasted a little bit by the libertarians because I suggested that the libertarians, if they want to have any real effect on the U.S. in the political sphere, they need to join the Republican Party. I said that because it is my view that if the libertarians join the Republican Party, it will inject the right kind of ideas that the Republican Party needs. From the video that was responded to by Improve Sheffield, there was a woman who was making some of the cases that Republicans often make to discredit or discourage socialized medicine. Now, it is my view that libertarians are closer to finding solutions to some of the problems that come up, like what to do with healthcare. Those ideas need to be injected into the Republican Party because right now all they have to say is, no, that's a socialist system, we don't want socialism here, etc., etc. There needs to be a deeper discussion, a more in-depth discussion that matches the complexity of the issue, and we're just not having it right now. And it is my fear that if we don't have that sensible discussion, that sensible debate, people will become seduced and more enticed by the idea of socialized medicine, when, in my view, there are better options that we can explore before going down that route. There are many ways to skin a cat, as I say, and that's what I'm trying to get at here. Now, the idea that not everything should be subject to the market is a topic that was addressed by Improve Sheffield. Now, I wonder, what separates healthcare? Why can't it be subject to the market? To a certain extent, in the UK, as Improve Sheffield mentioned, there is some degree of competition. For those who don't want NHS or who want a little bit more, they are provided the opportunity to get private health insurance if they want it. Now, I tried to find out some information because I wonder what the incentive was for anyone to join a private healthcare service or to pay for it. Is there any kind of benefit? Like, for example, in Australia, if you choose to go for private health cover, you actually pay less towards the public system. So there is some degree of incentive there. If you want to be taxed less or to keep more of your money, you can pay for private health insurance and you take that private insurance policy to the tax office and you do receive some kind of benefit. So there is some incentive for Australians to get private health cover. And last I checked, Australians, about 50% of them actually do have private health insurance. So there is some balance in the market there. People can get more and more service if they want to. And that's what I think the market is all about when it comes to healthcare. It's not like you're receiving any kind of better treatment or different kind of treatment. A surgery is a surgery, say. But there are people who have enough money that want to stay in a private room, for example, who don't want to have anyone else there. They want to be able to choose their doctor. They want to be able to choose where they receive a procedure, for example. That's what I'm talking about when it comes to the market and why there is and should be some degree of a market in the healthcare sector. And I think that exists already. It exists in the United States, and it exists to some extent in the UK because there are other options for those who want more choice. So when it comes to the market, I don't mean that it's unfettered capitalism and people just going for all the money that they can get off people who are poor and sick. I see it as more of a giving different options to different people who have the means to pay for those different options if they want to. Now, you mentioned about the price of energy in the UK, how it's very similar across the board. And I haven't looked too much into the price of energy in the UK, but I would say there's only two ways that it is possible for there to be fair prices across the board for everybody. The first way is for the government to intervene and to control the prices that people pay for energy, for gas, etc. The other way is that there are enough suppliers, there's enough competition in the market that it turns out a fair price. No single company can take over from the others. No single company can obviously have a monopoly and charge whatever they want. So those are the two means by which that is achieved. And you did admit that you voted for the Tories in this election, so I must commend you for that. And to me, it restores hope because, in my view, I think the British people are considering an alternate path. They're considering a new way of operating, a new future for themselves. I think the people are reconsidering their values and what they want, and I was impressed to see a positive outcome there. Because the last time the Tories tried to do a re-election with Theresa May, it wasn't the result that they were expecting. But under new leadership with Boris Johnson, it appears that that result has come, and the people are ready to go and forge ahead, and it was made clear in that election. So I am curious and optimistic about what's to come for the UK, and I hope the people of the United Kingdom are as well. I have been discouraged by some who haven't shared my optimism, but I believe in you and in your people, and I am confident that if you forge ahead as a united or a reunited kingdom, I am confident that good things will come for the country. Now, on the topic of foreign or alien, it being foreign or alien for governments to intervene, you said, the government is there to serve you and to help you. Now, you must understand that generally that is not the opinion of American people. What is our approach? Do you remember what John F. Kennedy said? He said, ask not what your country can do for you, but what you can do for your country. And I would say the same thing applies to the government. The United States and the American people are a people who look to themselves and what they can achieve for results in their lives, to make things better, to improve things. And that's where that locus of control should come from. It should come from the people who are inspired enough to say, we have a problem in our community, say, or in our own families, because that's where it all begins. It all begins in the family, and then stretches to the community, to the state, and then to the nation. If you have people who have it in themselves, who say, we can do better, we can improve, and that they are given the freedom and are empowered to make it happen, that is what is going through the minds of most Americans. They believe that they have control of themselves and their futures. And they aren't looking to a politician to solve their problems because the reality is they can't. There are local issues happening in communities, that politicians will never address because they don't have the time, they don't have the power, they don't have the money. And they're so far away from the issues that they can't be expected to solve all of our problems. And I suspect that has been the culture in the UK, and it's based on your video and your response to me. A lot of the arguments have been towards look at what the government could do for us. We elect these people so they can do things for us. I don't look for politicians to do that. I look for them to maintain freedoms, to impose, fewer laws, to impose less taxes on us. But it's unfortunate because it seems that people are often looking towards these people to give them some kind of outcome that they want, some kind of benefit or advantage. And I don't think the government necessarily is the place that should come from. And I suspect that it is a trend from the welfare state that has developed across Western countries for a very long time now, where the government becomes like the mother or the father over us all, and we are subject to them. And I know we are subject to them, but at least to some extent in the United States, there's this attitude or culture where people look to themselves first, because the reality is most government programs or anything that the government wants to give you or make happen for you will come at a cost to you. You will be taxed more. And I'm glad to hear the American in that particular video that you responded to, Improve Sheffield, make that point, that he doesn't want to pay more taxes. And most people in America, in the UK, in Australia, in the West, need to be conscious of that price, need to be conscious of how much they're paying in taxes, how much the government is spending. And I would argue in many places it is far too much. The government is spending far too much. And even if it is under the banner of improving things for everyone in society, we should be very skeptical. And the NHS, or a socialized form of medicine in the United States, is no different. It is absolutely no different. It'll be more taxes for people, and I just see it as a disaster waiting to happen if it was to be implemented right now. So that's why I try to make a strong case against it. Okay, in my video, I talked about how there are government systems, the laws in place in the United States that make it illegal or bar private hospitals and public hospitals from turning away patients who show up. If someone's having an emergency, a hospital has to treat them. That is by law. Now, the question is, why is it okay to formulate a law that compels hospitals to treat patients, but not okay for universal health care to come in? And I just think those are two very different things. Very, very different things. People are desperate, and at the point of that desperation, the law is on their side. And the main thing that I am against is the government coming in and taking over a market and saying it can do it better. And I just don't think that it can. So we're just talking about two very separate things, very different things. One is a law that hits the bottom line, say, of private companies and public hospitals, say. It's a totally different thing to say that a government's going to come in and implement price controls, etc. So they're just two different things. Another question is, why is it okay for Medicare and Medicaid and for veterans to have insurance, but not everyone else? That's basically the question that was asked by Improve Sheffield. And to be honest, I don't know if I agree with Medicare and Medicaid under the current system as it is. But those two things show that the United States isn't exactly a fully private system where if you can't afford it, you can't pay. Medicaid has been expanding and expanding to include many people, and it's mostly for the extremely impoverished and those who are well below the poverty line. Medicare is obviously for those who are 65 and older, and the reason it is in place is because they have been working for many years and they have been paying taxes for many years. And the system has been that you can work up until you're 65, and then when you retire, the government will step in and take over from your employer. And most people in America's employers provide them with health cover. So the government steps in at 65, but that is only after they have been paying into the tax system for a very long time. And the same for veterans. The veterans do a service to the country. They give something, and then in return, they are given a benefit. So I still think that is totally different. That is addressing specific needs. So the veterans are covered, the over 65 are covered, and with Medicaid, those who are impoverished receive coverage. So if anything, there is a case made that we don't need universal health care because, and I will argue this, the US, while it doesn't shout it from the rooftops, this Medicare for all, there are plenty of programs in place already that make sure that the majority of people in the United States have health cover. And I've already touched on this, but I'll just quote Improve Sheffield. That's the whole point of electing politicians, to make your life better, your life simpler. Close quote. And once again, I just cannot agree with that. And perhaps our differences come down to who we think is responsible for society. And I'm of the view that individuals and families are responsible for their lives, and that the government exists more so to defend freedoms, to defend the freedoms of people to act, in their own self-interest to the benefit of others. So they implement laws to ensure that people act fairly, that they compete fairly. That is more the role of government. It's not there so that every 4 years or so someone can come to me and tell me, this is what I'm going to do for you, etc., etc. Because I'm asking myself, what can I do for my own community? What can I do for my own family? What can I do for my own nation? And I hope everyone else has that perspective, at least to some extent. Because I think it makes for a society that is self-sufficient, that is self-reliant, and not dependent on the government. Okay, so I'll just start to wrap it up here because we're getting close to the 20-minute mark. But Sheffield had an issue with my comments on the copay, basically as a deterrent for abuse of the system. And I understand your point that it's not everyone who is just out to abuse the system. But it's a simple disincentive, whether you're a private, you have private insurance or you have public insurance, some kind of copay or some kind of payment, something that you bring to the table up front from your own pocket can deter abuses of the system. That's only one a benefit to having some kind of payment. And I'm not even saying it's a very high copayment. Like I said, I gave the example of Australia, who wanted to put in maybe $8 or so, but that was not pushed forward. All right, that sums up the first video. I suppose I'll respond to the second video as well. But once again, I want to thank Improve Sheffield for making the effort to make a video and for engaging in this dialogue with me. I hope many others can join in and give your opinions and share your views. Like I said, hopefully towards the end of that we can come to some kind of agreement or some kind of place where we can have just a more robust discussion. I think YouTube is a great place for that, and I think we're showing it now by having these exchange of videos. So thanks again, Improve Sheffield, and I will speak to you all soon. Thank you.